Welcome. I'm Mandy St. your Director of Partnerships and Communications, joined by my colleagues Lisa and expert advocate Glenn Kelly, and our partner from Troutman Pepper Strategies, Chris Baxter, who is going to be telling you a little bit more about the Medicare Part D cap and smoothing policy that's going to be coming into effect in January. So if everyone could just make sure you are on mute. It'll be a short presentation for the first 10 minutes, and then at the end, we'll stop share and open it up for questions using the hand raising feature, since I think we're going to have quite a few people on the call today. So Chris, I'll let you take it from here.
Yeah, thanks, Mandy. Good to see everybody again, and excited to give another short presentation on the IRA, the Inflation Reduction Act changes that are going to take place for Medicare Part D next year. So coming up pretty soon here, and like Mandy said, should get through these next couple slides fairly quickly to leave as much time as possible for your questions. So if we could go to the next slide, please. Yep, next slide, please. Yeah, just to kind of level set, like I said, all of these changes that we're discussing today were part of the Inflation Reduction Act that was passed in 2022. And just to make sure everybody's on the same page here, what we're specifically talking about is Medicare Part D. Those are voluntary plans that provide outpatient prescription drug coverages. And you can enroll in a standalone Part D plan, or that part can be included in your Medicare Advantage plan. And that is Medicare Advantage is a plan that's offered by a private company that contracts with Medicare that broadly covers all of the healthcare related services that would normally be covered. So just as a reminder for everybody on this call, open enrollment is now open. I think it opened earlier this month, or maybe late November. I forget exactly when, but it will remain open until December 7th. Next slide, please. So the first really significant change that's coming next year is, of course, the $2,000 cap on out-of-pocket costs. This will be adjusted every year for inflation, but for 2025, it will be $2,000. And this cap includes all of your prescription medications covered by Part D. That includes your deductibles, your co-payments, and your co-insurance for covered drugs when you get your drugs at the pharmacy. This is obviously going to be a very useful change, particularly for people who have really high out-of-pocket medication costs, and especially for people who don't qualify for any extra coverage, such as the Extra Help program. The chart on the right that you see here, I think really I threw that up here just because it really demonstrates how many people can potentially benefit from this new cap. The very bottom bar there, it's probably difficult to see on the screen, but basically it says since 2007 and 2001, almost 7 million people had at least 1 year where they were paying more than $2,000 in out-of-pocket coverage. So that really just goes to show how many people this cap can potentially help. I will also note, though, I don't think I noted anywhere on this slide, but this cap doesn't include your premiums for your plan. There's been a lot of concern that these changes to the Medicare Part D program, especially like the $2,000 cap, would lead to increased premiums in 2025. And because this cap doesn't include premiums, you might see variations in your premiums, your co-payments, and what covered drugs during your open enrollment this year. So I would just encourage everybody to look really closely at your annual notice of change that your plan has to send to you. And I think they had to send that by September, if I'm not mistaken. And that'll outline the changes that your plan will see in 2025. And then, of course, you can compare your coverage and your costs for all those plans using the Medicare Plan Finder. Next slide, please. Great. Yeah, the next big change that's coming next year is they're instituting what they're calling the Medicare prescription payment plan. This is a pretty straightforward change, but basically what it does is all Medicare Part D, all Medicare Advantage plans with prescription drug coverages has the voluntary option of doing this new program where basically you can spread out your costs over the course of the year. So this can be particularly beneficial to people who, let's say, have really high costs at the beginning of the year, because you can then spread those out over monthly payments over the remainder of the year. And I put the images on the right here because there's a helpful tool on Medicare.gov that you can go to kind of type in your circumstances, and it'll let you know. You can kind of evaluate whether opting into this plan is a good fit for you. Next slide, please. Thank you. Yeah, this is a little bit more of a convoluted, a little bit more in the weeds change that's coming next year, but I do think it's important. Basically, Medicare Part D, as it exists now, has four parts. It's the deductible phase, your initial coverage phase, the coverage gap phase, which is sometimes referred to as the donut hole, and then the catastrophic phase. So change next year that's happening is the coverage gap phase is going to be eliminated. So you'll no longer experience this period where you're potentially paying higher out of costs for the prescription drugs after reaching a certain spending limit. So instead, what will happen is the coverage gap, you'll continue to pay a consistent percentage of cost, 25%, until you reach the catastrophic threshold. And maybe to just, to level set and just kind of go through the steps of what you'll pay next year. And that's the right-hand column that you see on the far side of that table there. The first phase is the deductible phase. The only change there from last year is that deductible is increasing from $545 to $590, and you as the Medicare beneficiary is responsible for paying that full amount. And then once you reach that $590 threshold, you then move to the initial coverage phase. This is where the enrollees are going to pay 25% coinsurance for all drugs. And then this is also the phase where your plan sponsor typically pays 65% of the costs, or 75% of the costs in some cases. And then the manufacturer of certain drugs, through a new discount program that's also part of the Inflation Reduction Act, typically covers 10%. But then once you hit that $2,000 out-of-pocket maximum that we talked about earlier, you reach what's called the catastrophic phase, where you have no more out-of-pocket costs, and your plan or the manufacturer or some combination of the two will pay your remaining drugs for the rest of the year. And I think that's all we have. I know that was quick, a lot of information in a short amount of time, but wanted to make sure we had plenty of time for questions.
Yeah, and Chris, maybe I'll add a couple of comments for
Sure.
For everyone here. As a person on Medicare, just to kind of illustrate a few things. And actually, let's just go back into the slides if we might, because it'll just kind of support what you were talking about there. Not sure who was running the slides, but if you want to put those back up. Thank you. Yeah, go ahead and go back a couple, Mandy. Okay, so cap $2,000, great. Let's go to the next one then. And so first off, Medicare prescription payment plan. A lot of words, a lot of syllables. I think about it this way. So I don't know about people on here. I know we all have different types of medications that we're on, and some are more expensive, some are thankfully less expensive. But here's the reality, right? So one, you guys, I get a 90-day subscription or a 90-day prescription. If it's something like, say, a Jardiance or a Farxiga that tend to be, in the hundreds of dollars, it's like, wow, I have to pay that every 90 days. Well, with this plan, I could spread that out. So I don't get a several $100 hit for one medication, let alone if I have 2 or 3 several $100 medications, I don't have to take that hit at one time. It's kind of paid out, no interest, nothing like that. So I think that can really help with all of our budgeting, if we want to take advantage of something like that. Let's go to the next slide. Okay, coverage gap, and I want to talk about the donut, because we all kind of remember the donut as part of this, right? Where you have, the initial coverage, initial phase, then there's the coverage phase, which is really the donut phase, right? And so I don't know you guys, I get hit with the donut. I'm sure several others on here get on the donut. And all of a sudden you're like, boom, kind of hits us in the face. It's like, that's gone. No more donut. So what we end up paying for medications in, say, the January, February timeframe are the same thing we might pay in the September and October timeframe from eliminating that issue. The other thing about this then is when we think about, just, the maximum kind of we want to budget for the year, right? That's changing and it's becoming simpler for us, so that truly an out-of-pocket maximum is an out-of-pocket maximum, right? And so what all that looks like, so it simplifies it as we look at our budget over a given year. And so, the byproduct not only becomes simpler, but we're going to save some money in the process. So those are just some things I wanted to point out. I saw in the chat, and Harry, thanks for answering the question. Is there an interest charge associated with the payment plan? That's no interest. It's interest free. So.
Yeah, thanks, Glenn. That's all really helpful context. One thing I forgot to mention, actually, in regards to the $2,000 cap, I mentioned that obviously does not include the premiums you pay for your plan. There is a cap in 2025 on how much your plan can increase. And that's $35. That being said, that does not mean that your plan is going to increase its premium by $35. CMS actually came out recently, and I think they said the average plan is actually going down, although I'm sure that's not the case for everybody. But I just wanted to make sure that point was emphasized.
Yeah. Anecdotally, for what it's worth, many of you may have already seen and looked into what your options are through, Medicare Advantage plan for next year. My coverage is the same. The coverage got better through this, and the cost is no different. So.
Yeah, I'm sure it's very different across states, across, what your coverage is, and yeah.
So questions?
So should we go ahead and stop share now so we can see everyone? I think would be nice. Help us. So just go ahead and put your questions in the chat or use the raise your hand feature.
Our coverage could not have been that comprehensive.
Let me ask, is everyone, it is a general question, but is anyone not comfortable with finding the resources they need to feel comfortable about their insurance selection? That can be really hard.
Yeah, there's a lot of resources on Medicare.gov, but that can be very challenging to navigate sometimes.
Okay, now I'm off mute. Okay, you can ask a question now.
Can I ask a question now?
You have to raise your hand.
Oh, raise my hand?
You can go ahead, Gary,
Go ahead.
and your partner, wife.
Okay, I have a question now on because I'm on the extra coverage program. So do I have any limits next year as far as getting into the catastrophic program?
I think the best way to look at that is talk to, do you receive that special coverage? Is there an advisor for that in which you obtained that?
No, not as far as I know. I just noticed it on whenever I get the Medicare Part D form.
Okay. All right. You know, I don't want to mislead on that.
Mhm.
You know, and Jennifer in the chat's kind of raising something that I wanted to mention to everyone. Every state has their own kind of health insurance assistant program. Those are advisors to help you kind of
Oh,
selecting the right Medicare Advantage plan if that's the direction you're going to go.
oh,
It's at a state level. I'll put the address, I'll put the URL here in the chat, and then you can look up for your state, and it'll take you to your state level, and you can contact them as a stepping off point.
okay,
Good.
thank you.
Mhm.
Yeah.
Mhm.
Right there. And we know it's confusing. I'll just share anecdotally, while others might be thinking of a question. Last year, I did my parents. We kind of redid their whole Medicare structure, and their provider or their insurance carrier and so forth, in addition to Medicare. And so I went through, and they live in a rural county in Illinois, and there were 82 different Medicare plans available to them. Talk about wonderful choice. Wow.
Yeah.
Thankfully, I know how to use a spreadsheet or two, and I whittled it down for them. And in the end, we got down to a couple of plans, and then can make some informed decisions. But yeah, choice can be a good thing, and it can be a difficult thing. So for anybody with that challenge, I certainly feel for you. But this is a resource that can help.
Any other questions? If you want to just unmute yourself, you can do that.
If you're on a drug that's really expensive, does this change the Canada option?
I think it makes it less appealing,
Okay.
right? Very less appealing. Yeah. I have to kind of measure and see what they're projecting your drug price will be, which that's available now. You can go and take a look.
I have a question too.
Yeah.
If you get your drugs on a 90-day supply rather than a 30-day supply, does that make a difference in the cost of the drug then for the 3 months?
Yeah, that's an it depends kind of answer. It depends on what Medicare Advantage carrier.
I'm not on an
Straight
advantage
Medicare?
plan. Yeah, just Part D.
Yeah, just Part D. I don't know anecdotally if there's a difference. Generally, it's cheaper to get the 90-day, but I can't say that specific.
Okay, thank you.
Mhm.
We just have to run it.
Yeah.
Yeah.
Yeah, just have to see. Okay. Okay.
Interesting.
Well, if there are no other questions right now, you can certainly continue to email us questions and we can send them to Glenn and Chris and they'll answer and we'll get back to you. But hopefully you got some information you needed to make the right decisions for you and your healthcare coming up next year.
Did
Okay.
Mended Hearts come up with the term smoothing, or was that something that came from the government?
No, that's just the general term. The cap obviously refers to the 2K cap, and the smoothing is the payment plan. But no, those were the talking heads in Washington D.C. that I think came up with
Sounds
that.
like.
Yeah.
Okay.
Yeah, if anybody's needs sandpaper, let me know and we can.
Yeah. Thank you very much.
Yes, very
Yeah.
informative. Yep.
Well, thank you, Glenn. Thanks, Chris. And thank you everyone for taking the time to be on. It was good to
Yep.
see you all.
Thank
Thank
you.
you.
Thank you. Bye.
Bye.
Mandy,
Yeah.
uh,
Hey,
when I
Harry.
took a look at this thing, I had a tier 6 cost for Farxiga that cost me $11 a month. After I paid my deductible, it's now going to cost me a total of, with the new deductible, $1,998 a year for the same medication. And I can get it cheaper out of Canada.
Yeah, I guess there's probably more details around that. You know, I know that.
You need to look at, I only use PDP.
Mm-hmm.
I've got good coverage on everything else.
Yeah.
And it's definitely gone up. But
So is that,
I can get the medication on a 90-day supply cheaper out of Canada. And I think I'm gonna follow that route. So you need to speak with your doctor and see if they will allow that kind of prescription so that you can do that.
I don't know that that's the full picture about that.
Each one's individual, Glenn.
I'm familiar with Farxiga, I take it, that's why.
Right.
Yeah, and so there's the full retail cost of Farxiga, which is about what you were, I think, roughly what you were describing there.
No, the full would be about $4,000 to $6,000 a year out of AstraZeneca.
Okay, I was cited about 2,000. I'm just going off the top of my head right now.
Yeah, that's what the plan, that's because the plan has a $2,000 cap on it. So that's how come when I figured the cost, it came out to $1,998 for 2025.
Mm-hmm.
It was a cap of 2,000, so. Okay. Interesting.
I'm gonna review this again several times from several ways, and I think it behooves every one of us to take the extra time and effort to look at your particular instance.
Yep.
Because there are so many variables, and they really have changed it so much from 2024 to 2025.
Yeah, I support your notion there. Everyone is going to be a little different, and there are some resources there to help you understand those as well. Highlighted one here, and I think we have one elsewhere Chris had mentioned, and I think that's, but I think you're illustrating something there to dig into a little more. Thank you, Michael.
Yeah, I'm not sure how specific the Medicare Plan Finder tool gets, only because I haven't had to personally use it yet, but I'm not sure if you can, put in specific medications or costs or anything like that to, help whittle down your plans. But that, I mean, if you're not using that already, that could be something to look at.
Okay. Well, thank you, everyone. And Harry, always appreciate your comments and thoughtfulness on these presentations. So reach out if you need anything, and we hope you have a good evening.
Thank you.
Thank you.
All right.
Bye, everyone.